So first we'll hear from the County Executive, followed by our Chief Health Officer, Dr. Ernest Carter.
Hello, good morning, everyone. I want to thank you for being here this morning as we give an update regarding the coronavirus in Prince George's County. As you know, Prince George's County has been hardest hit really in the region regarding corona. Since March, we've had over 26,096 residents who have been sick with this virus. Over 3,698 have been hospitalized, and unfortunately, 774 Prince Georgians have lost their lives to this virus. And so in a 6-month span, this has just really been a terrible time for us in our county, and we continue to grieve with those who have lost loved ones, and we also continue to think about and pray for those who are still recovering. I can tell you, and I've said it over and over again, these are not numbers for us. These are people. These are the folks that we love, our neighbors, friends, family members, colleagues. This has been so personal for all of us, and so we have been really vigilant in the way that we have handled every decision around coronavirus. Governor Hogan announced Tuesday afternoon that the state of Maryland will move to the third and final phase of reopening with modifications this Friday ahead of the holiday weekend. And what I can tell you about Prince George's County is that we are not there yet. We still have, although our infection rate is around 4.1%, and you know that this has been a marked improvement for us. I want to thank Dr. Carter, thank everyone over at the health department. They have done a yeoman's job in terms of leading us through this pandemic. You may recall that we were somewhere in the neighborhood of 43% positivity rate in April. So to come down to 4.1% really has been a lot of progress for us. Yet we are concerned because we still have around 13 of our zip codes that remain over the 5% threshold. And so we remain concerned about rolling back restrictions before we see progress in those areas as well. The county is also seeing 11.4 cases per 100,000 people daily, which is above the state's rate of 8.7 cases per 100,000 people, and that's been the marker that's been used. With that said, we have again made astonishing progress in our county, and I want to thank every Prince Georgian. You all have done an amazing job in terms of adhering to the advice that we've been giving. We've been really listening to medical professionals, scientists as we've made decisions, and so this has allowed us really to make a lot of progress. But I should caution us that since July 4th, our public health officials have become really concerned about a resurgence of COVID-19 in our community. We know that leading into the July 4th weekend, our community was seeing a sustained decline in COVID-19 with low numbers and a low rate of infection. And after the 4th of July weekend and all of the gatherings that happened over that weekend, we saw a spike in cases, and we are still working to this moment to recover from that spike. And so I tell you that because it is critically important, and I want everyone to please hear me on this. It is critically important that we not become complacent with COVID-19. I know that we have dealt with this for a long time, and so many are getting restless. But as we approach this coming holiday weekend, I am urging all of you to please listen to my voice. You're going to hear from Dr. Carter, and I'm sure his voice will be even more stern than mine where this is concerned. But we do not want anyone to become complacent and to feel that COVID-19 is over, to begin hosting the large family gatherings and other things this weekend that will lead to a spike in cases and lead to a resurgence of these cases. Again, we are still recovering from July 4th, and so we are very concerned about Labor Day weekend. We want you to continue to wear your mask. We want you to continue to social distance. Again, the large gatherings, we will host those, God willing, next summer. But as far as this summer and this Labor Day is concerned, it is not yet safe for us to do that, and we want you to really listen to us regarding that. And I know that the pandemic has been hard on all of us in terms of our health, but we also remain concerned about the way that it has affected our business community. This has been devastating for so many of our businesses who have made sacrifices and who have seen losses, and we know that they are hurting as well. And so when our business community suffers, so does our community and our local economy. And so we really do appreciate the hardships that have been endured by the business community. We pledge to you, everyone in the business community, that we will be here for you, that we're going to continue to work alongside you to do everything we can to help you recover from this. We have dispersed funds through our Business Relief Incentive Fund. We've also held webinars and offered other resources to help our businesses stay afloat and get back on track. And I'm happy to report that of the 670 applications that we received through our incentive fund to assist businesses during this devastating time, we have allocated over $20 million, to be exact, $20,190,000 in grants to almost 60 local and small businesses. More than half of those have already received the funding that they applied for, so I want to thank the Economic Development Corporation, who have done an outstanding job in working with our businesses to try to push that money out to them that was critically needed to save those jobs and to keep those businesses afloat. We know that 78% of the recipients were minority-owned businesses, 43% were women-owned businesses, 5% were veteran-owned businesses, and 6% were Latino-owned businesses. And so we believe that the dollars we disperse, the $20 million, really will go a long way in terms of saving jobs. You know, we have lost over 154,000 of our residents have become recently unemployed, and so it's been really important to us to make sure that we spare any additional job loss. And while we reopened at a rate that was measured and safe for our community, we launched also the COVID-19 Ambassador Compliance Program to inspect businesses to make sure that the actions of a few do not go on to affect and have far-reaching consequences for the whole community, requiring us to close those businesses again. So that compliance team, the ambassadors, you'll see, are very serious. They have been doing a wonderful job. And I want to thank the business community who have stepped up. They have been so responsible in making sure that their businesses are complying with all of the rules, with the wearing of the facial coverings and the social distancing. And so we really want to compliment the business community and ask all of those who are patronizing those businesses to be respectful when you go into the businesses and make sure that you are assisting them. I've been in a good number of businesses, and I think that most are complying, but I want to remind people that when you go in, the mask is not to be worn beneath your nose. All of the doctors and scientists tell us that the virus exists in your nose, and so it is not helpful to any of us for you to simply cover your mouth and have your nose exposed. That's the way that the virus is spreading. So when you go into those businesses, we're asking for the good of all of us, for the good of the business, for the good of those who are patronizing the businesses, the grocery stores, and other things, to keep all of us safe. Please properly make sure that the mask is affixed in a proper way so that we are not seeing the spread of the virus. And if we stay the course and continue to take the steps that are necessary to reduce the spread of COVID-19, we are convinced that we will be able to reevaluate in a couple of weeks the data that we have, and that we will be able to at some point move toward a modified phase 3 reopening here in Prince George's County as well. I can tell you that we are interested in the long game. I know that, again, we're asking for many, many sacrifices to be made, but we are looking to make sure that whatever openings we make are ones that are sustainable and are responsible. And so we're taking our time to make sure that this happens. So, again, to refrain from the get-togethers with large numbers, practice social distancing, good hand hygiene, wear your mask, and we believe that we're going to be able to continue to open up and to move our county forward. I have two other topics that I'd like to talk about. The next one is voting. As you know, COVID-19 has changed a lot about our county, and voting is no exception. And it is critically important that we do everything we can to make sure that Prince Georgians are able to vote in the 2020 election. As you well know, this is a right that so many have died for, fought hard for, and we want to make sure that in spite of COVID-19 and all that we have experienced, we want to make sure that Prince Georgians are able to vote in the 2020 election. I know that many, if not most of you, have already received your mail-in ballot applications in the mail. And I have to say that word so that, that everyone understands what we mean by that. To be clear, what you received in your mail, and many of you received it by last weekend, is a mail-in ballot application. It's not junk mail, so please do not cast it out. It is likewise not the actual ballot. I'm concerned that this will be a point of confusion for many who will expect that we will do things as we did for the June 2nd primary, where those ballots were mailed directly into your home. You should know that what was mailed to your home on this occasion was not the ballot. This time, what the state decided to do was to mail to you the ballot application. And it is critically important that you understand the difference between that. In order to vote by mail, the mail-in ballot application must be received by October 20th. So that now that you have your ballot application, the mail-in ballot application, you must fill that out immediately. Send it back in the envelope that you've received, and have that by October 2nd. It has to be received in order for you to receive the actual ballot, which will come to your home. We expect that those actual ballots will be received beginning at the end of September, the beginning of October. You should look and you will have the actual ballot that should arrive in your home. And what you should do at that point is to fill it out, and you can return that ballot immediately, which we want you to do. You can also take it to the Board of Elections in Largo, and we will also have, hopefully by the beginning of October, those sites. We will have 11 sites around the county where you can deposit that ballot ahead of election. And this is what we want you to know. Vote safe and vote early. Vote safe and vote early. And so, again, to go over it, make sure you return the application immediately so that you can get your ballot. And once you have gotten that ballot, we want people to begin to send it back early. We know that there are a good number of individuals who still prefer to vote on Election Day. And if that is the case, then we have also made it so that beginning October 26th, which will be the early voting period, is extended now from October 26th through November 2nd. You can go to those 11 sites around the county to vote early. And on Election Day, we will expand to 40. We have 40 sites around the county that you will be able to vote, as well as we've also made application and sent a request so that we can also use the FedEx field. And I want to thank the Washington football team for agreeing to work with us to make that field available to us so that we can accommodate a larger number of voters there. And we are waiting now to receive word regarding that particular site. We expect that it will be approved, and with that, that will be the 41st site. And so we will have 41 sites available on Election Day. You all know that this is in part, again, because of COVID-19. We've had to change the way that we have really approached this election. Hosting a, quote, normal election would have required that we had 3,500 election judges and volunteers, and most of those were seniors. And there was no way, it would be unconscionable to send 3,500 seniors into these spaces and ask them to help us conduct a, quote, normal election. And so instead, I've made the request, we made the request of the governor that we be allowed to consolidate into these super centers that have resulted in the 41 sites, hopefully, that we will have available around the county. What I also want to remind you of is that the deadline to register to vote is October 13th. So that's a deadline I want you to remember as well. And so if you are not registered, you can go online to the Board of Elections and do that first before requesting your mail-in ballot. And also to remember, again, the other deadlines, that early voting will start October 26th and go through November 2nd. Remember also to fill out your mail-in ballot application by October 20th so that you can get your ballot. Now, also, we want you to know that the early in-person voting centers will be open from 7 a.m. until 8 p.m., and residents may cast their vote in any of these early locations as always. And so this is what we want you to know, is that we are going to do everything in our power to make sure that absolutely nothing stops Prince George's County from being able to show up in this next election. And you should know that the mail-in ballot has been extremely effective for us. that in the last election, we saw that 96% of Prince Georgians voted by mail. We also know that as a result of having mailed those ballots into the home, that we saw the highest voter participation that we have seen since the 2008 election. So we are expecting that we will exceed the number of participants that we saw in the June 2nd election. So this is going to be a historic turnout that we expect for this election, and we're going to do everything we can to be prepared for it. The final item that I wanted to discuss with you is child care. You should know, again, that there have been so many ways that we have been impacted, that the coronavirus has impacted us, and one of them is in the area of child care. It has been really, our child care centers have been hit hard. In fact, we know that about 40% of them have been unable to reopen as a result of the coronavirus, and that our parents have been adversely affected. This has been very difficult for families who have been trying to find ways to find safe child care for their students and children. And so we are doing really what we can to make sure that as a county, this will be a priority for us to assist our families and parents. And so the county has already set aside, we used $725,000 to maintain our child care facilities. We provided grant funds to those facilities to make sure that they were able to make payroll, cover mortgages and rent, pay utilities, and buy personal protective equipment. But we're going to continue to do more, and this program will provide grants to child care centers that have had to close their doors. And what we wanted to announce as well is that we have now, I have allocated an additional $2 million of CARES Act funding to our child care program, and we are going to allocate $1.4 million for child care centers and $600,000 for child care for those who care for children in homes. To qualify, our child care providers must, of course, be licensed. They must fill out an application and provide a set of required documents, including proof of licensure. They must also meet several eligibility requirements, and the child care providers may apply for those funds from September 4th through September 18th. Again, that's September 4th through September 18th. And this is a very important program that we have started. It's called the Child Care Provider Recovery Program. And we'll continue, again, to make sure that we do what we can to support all of our families and our precious children. So we're still making progress where COVID-19 is concerned. You know, I'm a little biased. I just happen to think that nobody's done it better than Prince Georgians, especially considering where we came from, that you all have adhered from the first moment we asked you to all of the messages and all of the advice that you've been given. You have done a beautiful job of looking out for each other. And I guess my request of all of you, most especially as we approach Labor Day weekend, is don't stop. Let's continue to do what we have done as a county and as a community, and that is to stand up for each other, to really make sure that we're protective of each other. Again, I'm asking you as you go into these businesses to really be very respectful and mindful that they are doing their best to make sure they keep you safe and keep all of their employees safe. So to wear the mask appropriately and to cover your nose, please don't put it down beneath your chin or on your nose, but to please make sure you're doing that. Social distance, wash your hands. And really, I know how difficult it is because I love to get together with my family as well. But this weekend, we are asking you please to refrain from the larger family gatherings. Dr. Carter told us recently that about 40% of our cases, especially after 4th of July, were generated during those family gatherings. And so we want you to be careful. So we're going to make it through this together. Thank you again so much for all that you have done. And I want to thank, lastly, all of our employees, our frontline workers, essential workers who have been on the front lines during this crisis and have done a yeoman's job, and we just really appreciate it. The best is yet to come, and we are just going to continue to hang in there. So with that, I'd like to bring up to the podium Dr. Carter for his updates. Thank you.
Thank you, Madam County Exec. Good morning, everyone. Since the beginning of the pandemic, data and reasonable caution has driven our decision-making. Right now, our numbers, while continuing to improve, clearly show it's not safe for us to move to phase 3 yet. We do not want another curve to overcome that puts our residents at high risk. We've already done that twice now, and each time it took us months to get to a flattening. We're coming up on another holiday weekend. If we stay vigilant together, the road ahead can be a lot smoother. If we don't wear a mask, if we don't stay 6 feet apart, and we're not smart about our personal gatherings this weekend, we might as well buckle up for another big surge. I'm going to go a little bit into the numbers now. By the end of June, our initial case curve, the one that formed in March, the large one, became a nice downhill slope. At that point, we had 577 new COVID cases a week. The week following July 4th, our numbers shot back up. For the rest of July, Prince George's County saw almost 1,000 new cases a week. Today, we're seeing a decline in these new cases a week. However, the number of new cases last week is still hovering around 700. That's still way above our summer low point of 577. That's before the July 4th weekend. Additionally, I want you all to know that nearly 1 in 4 of Maryland's cases have been our residents. And the more than 780 Prince Georgians who we've lost to COVID accounts for 1/5 of those who died in Maryland. This shows we're not out of the fight. We need to see further reductions to feel comfortable about moving into new reopening and new phases. When our cases crept up in July, so did our hospitalizations. We went from 45 people per week hospitalized in county hospitals due to COVID to 65 by the end of July. Thankfully, our bed space capacity remains in pretty good shape. About 60% of ICU and acute care beds are available in our hospitals with the additional surge capacity. However, the number of people in a hospital bed in the county due to COVID is not dropping as much as I would like to see. We have been hovering around 60. Our infection rate is slowly declining after the uptick in July. The infection rate measures how many other people a COVID-positive person infects. Right now, the county infection rate is just slightly under 1 at 0.92. That means each person in Prince George's County with COVID is, on average, infecting just under 1 other person. This means the virus is still slowly spreading in our community. We want to keep the infection rate as low as possible. Before July 4th, our infection rate was 0.74. So you see, we've come up. Another key data point in is our positivity rate, which the county executive spoke about earlier. This is the percentage of COVID tests that comes back positive. Throughout August, it has slowly declined, and in mid-August, we finally dropped below 5%. That's sort of the benchmark. Right now, we're at 4.1% positivity rate. We have only been below 5% for 2 weeks. Given the increase we saw after July 4th, we should be very cautious assuming that this is going to continue to go down. Additionally, our positivity rate is higher than the statewide average of 3%, and it remains one of the highest one in the state. I'm giving you a steady diet of numbers today because it shows where we are and how important it will be this holiday weekend to be smart, safe, in order to stay healthy and well. As the county executive said, but it bears repeating, we all must wear a mask when we're around people in public who are not members of our household. Please remain 6 feet of distance from others who are not in your household. Wearing a mask, staying 6 feet apart, work together in tandem to keep us safe, healthy, and free from COVID. We must perform both to slow this virus down. Avoid crowds, please. Don't host large parties. Don't attend large parties. As the health officer of Prince George's County, my number one job is protecting the health of nearly 1 million residents. I know how disappointing it can be to hear some of our neighbors are reopening more quickly than we are. But it's just as soon that we don't reopen so that we won't take a backwards trend. I also understand how difficult the pandemic has been on our business community. On a personal note, before I came to the health department, I was a small business owner. I owned retail clinics in 4 states in the United States. And I bought those in 2007. And you know there was a huge recession that showed up in 2008. And when that happened, I had to meet the challenge of trying to keep that business open. It was very difficult. So I have lived through that, having to lay people off and telling people they no longer have insurance or they don't have enough money for child care. I've had that experience with over 90 employees that I've had. And I can tell you, I do not, as the health officer, want our county to suffer through that because it's extremely difficult. And these are just tough questions. And this pandemic has forced all of us to strike the difficult balance between protecting our public health while maintaining economic health as much as possible. The health department is working extremely hard together with the county exec's office, our public and private partners to monitor the situation and make the right choice for our county. And that's extremely important for you to know. Each of you is a critical partner in this effort. We are all on this team, and we have to stay the course, do the hard work. If we do, we'll slow and control this virus and ultimately defeat it. Thank you very much.
Okay, so now we'll take any questions. Dominique?
This question is for Dr. Carter. I'm curious to know, because of the high number of cases Prince George's County has seen more than any other part of the state, how close are we in this county to possibly herd immunity? The idea that if the more people that have it, the fewer people will be sort of impacted by this.
If herd immunity is not a public health solution. That's number one. If we had, when the virus first hit, if we had allowed herd immunity to go on, we would have experienced somewhere in the order of 10 to 30,000 deaths, and 60 to 70% of the community would have acquired the disease. That's not a public health solution. Herd immunity is, if you advocate herd immunity, you're basically advocating that some people will die, and that's okay. So the plagues that you have read about in history, the Black Plague, they acquired herd immunity, but they lost millions of people. Native Americans in this country who got exposed to viruses when Europeans first came over, they didn't know about what we're doing. So they lost 80 to 90% of their population. Herd immunity, it shouldn't even be brought up in the conversation of public health.
Yeah, Tracy. You said for county executive?
Yes.
Oh, I'm sorry.
There have been county executives who have complained about Governor Hogan not coordinating with counties and coordinating announcements. Can you respond to that? And then also, do you have a response to President Trump saying that he should vote twice?
Oh, well, voting twice is illegal, so I think we can just start there. And, I don't know that I even have to say how breathtaking it is to have the President of the United States suggest that we should break the law. So we obviously don't agree with that. And we believe that people should vote according to the law, but by all means they should vote. That's what we believe. And you talked about the county executives who have complained. You know what? We're all trying to make it through this together. And what I can tell you is that we have communicated with the governor's office and that they have been available to hear from us. That, has the communication always been perfect and seamless? No. But you know what? I think that we're all doing what we can to make it through this pandemic, and we are just focused, I am focused, on making sure that we make good decisions for the people who live here, and that we are, to Dr. Carter's point, tailoring our decisions to our residents and to the data that we have. And I think that we'll make it through this together. I've been enjoying a really, really strong relationship with the other county executives. We talk weekly, share information with each other, and you're right, at times we've been, there are things we've been concerned about, and we talk about them. But for the most part, we're all just doing the best we can to make it through this. And I have felt that when we reach out to the governor's office, we get a response from them. And I have not felt that they don't communicate with us, although we've had concerns and we've made those concerns known. We don't always agree. Let me just say this. I do not agree with all the decisions that have been made, and I've said so. When I don't agree with the governor's decisions, but the communication, I believe, has been good.
I guess you talked about the unemployment rate for Prince George's County, and we know it's the third highest one in the state of Maryland. Given the fact that I know, even though Maryland's moving into phase 3, Prince George's County and our neighboring county, Montgomery County, are moving in a different direction. I know you touched on that. Can you elaborate a little more on if there was any reopening within Prince George's County? I mean, that could help some of the unemployment rate. Obviously, our businesses as well. Can you can you expand a little bit more on that?
Well, the point is that Prince George's County is situated different than any place else in the state. Dr. Carter just mentioned that we account for about a fourth of all of the cases in the state, which is huge. And so we don't compare ourselves to other jurisdictions because they are not comparable to how we are. We're disappointed about our job losses, very disappointed because Prince George's County has led the state in creating those jobs over the last 5 years. So we have created more jobs than any jurisdiction in this state over the last 5 years, year over year. So nobody is more disappointed than we are over the job losses. And if you consider Montgomery County and Prince George's County together, we account for 40% of the state's economy. So we do not take lightly closing businesses and not moving to different phases. But we also know, again, that we have to make decisions that are both responsible and sustainable. Opening today and having to close again tomorrow is not a good choice. And so the decisions we're making are really designed to make sure we can continue into the future. And we'll continue to make those decisions. But we expect that we'll be able to continue to open. But we just have to do so in a responsible way.
Exactly. Morning. Governor Hogan, his third phase of the recovery plan mentions in terms of high-risk activities such as movie theaters and indoor venues wouldn't be done until there was a vaccine or effective therapeutics. It's right there in his plan. Do you see this just as him pushing this third phase as political, especially with the county and Montgomery with certain high number of cases, wanting to move too quickly?
You know what? I don't want to question anybody's motives. What I can tell you is Prince George's County is not ready to go to phase 3. Dr. Carter and all of the other medical professionals tell us that those indoor spaces are where we run into danger. In fact, we've been in contact with California and other jurisdictions that have really seen their numbers, the resurgence of numbers, and have had to go back to closing. And when we talk to those jurisdictions to ask what it was that they thought caused them to be in a negative position, they have said that they regretted those indoor spaces, the bars, the areas, the movie theaters. Those are the kind of things that create super spreader situations. So we're trying to learn also from jurisdictions like Los Angeles and others that we've reached out to ask them about what their experience has been and try to make decisions based on what we're learning.
Right.
Well, some of the questions have been asked. I talked with a leader of a large church, Reed Temple. He said they're not ready to open. They got so many people gathered. I mean, and that's sort of a Prince George's thing. A lot of big churches. How big a thing would phase 3 have even been for this county? I mean, retail's already all over. Movie theater. What do you hear from churches? What do you hear from the movie theaters? The movie theater people. I know they're lobbying in Annapolis really hard. What are you hearing from those two? Because I think that's really the large.
That's a really great point, is that most of our economy is already open. So I think your point is a good one, is that, for us, phase 3 would have included a few more openings, the movie theaters, increased capacity for churches. But I can tell you that we have worked most especially with the faith community, and they have been amazing. They understand, they care about their members. So in spite of whatever losses they have seen, and this has been a very trying time for the faith community, they have mortgages and other expenses too, but they have in every instance put the health and well-being of their parishioners first, and they have done the best they can to go virtually and to just make sure that they are making decisions that are good for their parishioners. And I believe that those other businesses have been the same. The movie theaters, the others, I know that people want to open, but from my experience, they have all been very reasonable and have been working with us. I don't know whether Dr. Carter, if there's anything else you can say about the movie theaters, but in my experience, they have all been really wonderful to work with and have been concerned about their employees and the people who attend those churches.
Conversely, Wegmans is crowded, Walmart is crowded, Lowe's, Home Depot, they're all crowded. What's kind of the difference? Why not allow movie theaters to go in 25% capacity or something like that, which I think Baltimore's going to do?
So it's not that we won't ever allow it. What we're saying now is that we open the spaces that, obviously grocery stores are essential. So we have to open grocery stores and make it possible for people to go in those areas. But we are going to make the other decisions as we go along. And there's no comparison between movie theaters, some of the other indoor dining. Those, again, are the areas that we've all heard really contribute to the spread of the virus. And so we're being really cautious and really responsible. And it doesn't mean we won't ever open. It just means right now as we hover in between 4 and 5% positivity rate, and as we have 13 zip codes in the county that are still over 5%, this is the kind of information we're using to make the judgment. It's not because we don't want to go to the movies. It's because we believe that based on the data that we have, it makes it unsafe for us to do so at this point.
Could you just explain very succinctly in terms of what County Executive Alsobroooks was mentioning about why movie theaters are a harbor for the virus, please?
Well, number one, they're indoors and you have a bunch of people crowded into the theater. That's number one. Number two, it's very hard to social distance in a movie theater, and they're in there for a prolonged period of time. And when you go to Wegmans, you're in, get your groceries, go out. In a movie theater, you're never hours. You know, there is one explanation about being aerosolized versus the droplets. That's still controversial. Why take the chance? So where we are right now is we say we're not going to increase our probability of spread by opening things that are closed that we don't need to open now. So it's reasonable. And all across the country, as the county executive said, it's been shown that movie theaters and other places can cause high spread. So we have to be cautious, and that's what we're going to do.
Tony?
Executive, I had a question about the 41 voting centers that you mentioned earlier. Does that include FedEx Field, or is that FedEx Field sort of be added on top of that as 42?
That would include FedEx Field. So right now there are 40 sites, and if we get the permission that we expect, then FedEx Field would be the 41st site.
And will this be set up outside of FedEx Field, kind of like we had for when we were doing testing at FedEx Field, or would those be inside FedEx Field, having people go in to vote?
You know, I think they're working out the details about the setup, but what we anticipate is that it would be inside on the field where they would have the different stations set up for people to vote. But the complete setup, I think they'd give us more information about that going on, but the Washington football team is working with us on it. We really appreciate it.
Any other questions? Thank you all for coming.
Thank you. Thank you, Dr. Farber.
Thank you.
Michael's upstairs. Do you know Michael? You covered the story today?
Oh, yes?
Yeah. He's up there.
I never know these.
Oh, okay.
The line of right spot.
Nope, you're in the
Oh, oh,
You're in the exact perfect spot.
I didn't know. Sometimes.
That's it.
That's why I kept
There's no way this is going to
Jump on the hook and stand down the pole and go see the ball.
Thank you, how are you?
Thank you.
Nice meeting you.
Oh, wow. Exactly. Exactly. That's the bit of it.
I'm hanging in there.
They got that thing good. Oh, I couldn't stand. I couldn't stand.
We're all hanging in there.
Yes, we are.
Oh.